Medieval field medicine. With serious injury and occupational hazard for the soldiers of the Middle Ages, treatment ranged from a swift bit of stitching to a surgeon with a saw. The medieval world holds a romantic fascination with its tales of knights in shining armour, jousting contests and battles, ideally for the hand of a fair maiden or the honour of a kingdom. Yet the real thing wasn't quite as dashing as fiction makes it seem. In the Middle Ages, warriors were more likely to be met by a barber surgeon with a bone saw than a princess. It was a time of war and bloodshed, and rather unfortunately, a time before modern medicine and surgical techniques. Yet in a time where violent battles were an occupational hazard, patching up soldiers so they could get back to the field was an essential skill. In early medieval combat, the wounded would be left where they fell as the fight raged around them. Only once the smoke of battle cleared would survivors, if there were any, be gathered up and taken to the nearest place where care could be provided, often a monastery. However, as the years passed and efficiency became ever more important, armies began to travel with their own physicians and surgeons. In the largest and best equipped of these, often amounted to field hospitals. These impressive setups could boast a team of physicians and surgeons, as well as a baggage train bursting with medical supplies and equipment. For the more humble, of course, the reality was nothing more than a quack, a doctor with very little medical knowledge, armed with a blade and a fire. Soldiers relied on barber surgeons for their care, men who followed the troops and provided treatment for battlefield injuries, while physicians were on hand to treat other maladies. When it came to surgery of all types, it was the barber surgeons the soldiers turned to. Higher ranking men employed their own surgeons to travel with the army and could expect to receive immediate care. For the majority, however, this was not the case. In many instances, particularly when it was delivered on the edge of a chaotic battlefield, medical care was quick and without a great deal of care. With medieval weaponry dealing some pretty savage blows, injuries were frequent and often fatal. Even if the casualty survived the first onslaught, the treatment alone might be the death of him. To make matters worse, anaesthetic was wanting and sterile environments and equipment non-existent. However, experience has taught surgeons that a person who is writhing in agony or senseless with panic is not easy to treat. So they did make an effort to ensure that their patients were anaesthetised to some degree before extreme procedures were attempted. If a knight was lucky or had the money or connections to afford a more forward-thinking caregiver, he might be given large amounts of alcohol or even a jolt of something containing opium. But with supplies short and expensive, these methods were reserved for those who really needed them. In one or two cases, a knock on the head might render the patient unconscious long enough for the operation to take place, while others simply had to bite down on something and ride out the pain. Today, the idea of amputation or other surgery without being sedated or at least numbed with local anaesthetic is unthinkable, but that's precisely what medieval battlefield medicine entailed. In often chaotic circumstances, surgeons would tend their patients, amputating mangled limbs with a saw or stitching dressings and cauterizing wounds. Cauterization, sealing the end of the amputated limb or other injury with a cautery, a hot iron that had been heated in a fire, was risky An agonising procedure, but it worked, at least as long as no infection set in. Mindful that this could be deadly, some practitioners used alcohol and St. John's wort as antiseptic agents, while others used honey, yes, honey, while applying dressing, and poultice, a kind of paste, to wounds. While medics in the Middle Ages understood that things should be kept as clean as possible, with no sterilisation and surgery often happening practically on the battlefield itself, this was next to impossible. Instead, the name of the game was speed, and with casualties pouring in thick and fast, there was little time for anything but the necessities. Open wounds were washed and stitched with a needle and catgut, then bandaged or cauterized. Broken arms and legs could be splintered and set, but if smashed beyond repair, out came the saw and off came the limb. Medieval texts even contained stomach-churning descriptions of attempts to treat skull fractures or head injuries by trepanning, making a hole in the skull to relieve pressure, a procedure that frequently killed the patient. Arrows were an occupational hazard for the medieval soldier, and getting them out could do more damage than the arrow itself. If it was deeply embedded, a surgeon might cut off the flight and stem and push the arrow through until it could be drawn out the other side, hopefully without hitting anything vital on the way. If that wasn't possible, the arrow could be cut out. A quack might well just yank it right out, pull it right out, causing additional trauma to the patient, while a more sensitive surgeon would attempt to soften the flesh around the wound until the arrow could be gently worked free. Neither option was an easy ride. Away from the battlefield, the romantic ideal of the medieval knight was not without its risks. Take, for instance, the jousting match and its very real risk of injury. While many of these would be minor cuts and bruises, broken bones and open wounds were a distinct possibility. What started as a sport could soon turn fatal, and just as in battlefield medicine, where herbal poultice could be applied for more minor injuries, unsterilised catgut sutures were used to stitch up wounds sustained during jousting. Ironically, the suture itself sometimes caused an infection that was far more dangerous than the initial injury. Physical injury was ever present for knights and soldiers in the Middle Ages, and disease could also wreak havoc. Medieval sieges were often long, drawn-out affairs, and for those on either side of the wall, illness was a constant danger. Crammed together in cramped and rudimentary conditions, with the barest minimum of hygiene, besieging armies often fell prey to typhoid and dysentery, and securing fresh food and water was increasingly difficult as the siege wore on. Additionally, sieges inevitably meant death, and as the corpses piled up and graves were dug and filled in haste, the stench, the smell, and risk of infection only grew. At the siege of Harfleur in 1415, more English and French soldiers were killed by dysentery than by actual combat, and once an illness entered an encampment, there was no way to stop its spread. Add to that the fleas and other pests that were rife, and life on either side of the fortifications was miserable. Some commanders attempted to position their armies in locations that allowed for sensible spread of tents, a fresh water supply, and plenty of space between the food, water, and toilets. but this could not always be maintained in a prolonged siege. A protracted, long deadlock could ruin even the best laid plans, and as soon as dysentery or similar disease began to infect the soldiers, it could spell disaster. At a time when anaesthetic was virtually unheard of and basic hygiene in battlefield and siege medicine could be wanting, the medieval soldier faced an uncertain fate. A visit to the barber surgeon carried with it torments and risks of its own. Of course, for the wealthy and fortunate who could travel with their own hand-picked medics, there might be a fighting chance. The majority, however, had no choice but to place themselves in the hands of the barber surgeons. Some of them were skilled practitioners, and some were quacks. But for everyone, there was always risks associated with battlefield and siege medicine. As some soldiers found to their cost, it might not be the battle that killed them, but the men they turned to for help.